You might think yellow nails are just a cosmetic issue, but what if I told you they could be the first warning sign of something much more serious, like diabetes, liver damage, or even a hidden lung condition? After age 50, your nails become silent messengers of your health, and ignoring their signals could cost you more than just your looks. Stay with me, because in the next few minutes, you'll learn exactly what your yellow nails are trying to tell you, and how to fix it before it's too late. As we age, our body sends us subtle signals, tiny whispers before the storm, and one of the most overlooked areas? Your nails, especially when they start turning yellow. Most people brush it off as aging or nail polish residue, but in reality, it could be a red flag for a serious internal health issue. In this video, we're breaking down the 7 medical reasons your nails turn yellow after 50, and how to spot the difference between harmless changes and signs that something deeper may be going wrong. Let's begin. Let's 1. Fungal infections, the silent spreader. The most common reason for yellowing nails, especially after 50, is a fungal infection. Medically known as onychomycosis, this type of infection sneaks in through tiny cracks in the nail or surrounding skin. It starts slowly, maybe just a small yellowish tint at the tip of your toenail, but over time it thickens, discolors, and even causes the nail to crumble. Here's the kicker. Fungal infections love weakened immune systems and reduced blood flow, both of which are more common as we age. And while it may start with one nail, it can spread to others, and even to your skin. Left untreated, it can become painful and lead to more serious complications, especially for diabetics. The solution? Early diagnosis and antifungal treatments, either topical or oral, depending on severity. Fact: over 14% of adults over 60 are affected by nail fungus, but most go undiagnosed until it's too late. 2. Diabetes. Sugar leaves clues on your nails. Yellow nails might be your body's cry for help if you're battling undiagnosed or uncontrolled diabetes. High blood sugar doesn't just affect your energy or your weight. It literally alters the protein structure in your body, including keratin, the building block of your nails. This leads to a pale yellow discoloration that's often mistaken for aging. But here's the deeper issue. Diabetes also impairs circulation, making it harder for your nails to get the nutrients they need to stay healthy. And that slow blood flow creates the perfect storm for infections to take hold, especially fungal ones, which thrive in high sugar environments. If you notice yellow nails along with symptoms like excessive thirst, frequent urination, or tingling in your hands or feet, it's time to get your blood sugar checked immediately. Stat: according to the CDC, nearly 1 in 4 adults over 65 has diabetes, and many don't even know it. 3. Lung diseases, when breathing problems show on your hands. Yes, your lungs and your nails are connected. More than you think. If you're over 50 and notice your nails turning yellow, thick, and slightly curved, it could be a hidden sign of a chronic lung condition like chronic bronchitis, emphysema, or even COPD. This happens because poor lung function reduces oxygen in your blood, and your nails, being at the farthest point from your heart, are often the first place these low oxygen levels reveal themselves. The yellowing occurs as a result of sluggish circulation, combined with buildup of lymphatic fluid beneath the nail bed. It's called yellow nail lung syndrome, and while rare, it's dangerously underdiagnosed. If you also notice shortness of breath, chronic cough, or fatigue, your nails may be sounding the alarm on a much bigger issue. Fact: nail discoloration has been documented in over 80% of patients with yellow nail syndrome, most of whom had undiagnosed lung conditions. 4. Liver dysfunction, toxin buildup, turns nails yellow. Your liver is the body's detox center. But when it starts to slow down, especially after 50, waste and toxins can begin to accumulate in your bloodstream. And one of the first places this imbalance shows up? Your nails. A sluggish liver can cause your nails to appear yellowish or even mustard-toned, often accompanied by ridges or brittleness. This discoloration is caused by a buildup of bilirubin, a pigment that leaks into the skin and nails when the liver can't process it efficiently. If yellow nails are paired with fatigue, bloating, dark urine, or yellowing of the eyes, it's not just an aesthetic issue, it's a potential warning sign of fatty liver disease, hepatitis, or even liver failure. Stat: Non-alcoholic fatty liver disease affects 1 in 3 adults over 50, and most cases are silent until visible signs like yellow nails appear. 5. Vitamin and mineral deficiencies, especially zinc and B12. Think yellow nails are just about age? Think again. They might be screaming for nutrients your body desperately needs, especially zinc, vitamin B12, and iron. As we get older, our bodies don't absorb nutrients as efficiently. Even if you're eating well, low levels of these vital nutrients can lead to discoloration, slow nail growth, and brittle yellowing nails. B12 in particular affects oxygen delivery and pigment in the nail beds, while zinc is essential for healthy nail structure. People following restrictive diets, dealing with digestive issues like IBS, or recovering from illness are especially at risk. And the fix? It could be as simple as a targeted supplement or dietary adjustment. Fact: a study in the Journal of Dermatology found that over 40% of adults over 50 with yellow nails had underlying micronutrient deficiencies. 6. Thyroid disorders, yellow nails as a metabolic warning. Your thyroid controls everything from your metabolism to your mood, and yes, even your nails. When thyroid hormone levels drop, your body's systems begin to slow down, and your nails can become thick, yellow, brittle, and slow-growing. This is especially common in hypothyroidism, a condition where your thyroid underperforms. Women over 50 are particularly at risk, and the symptoms are often mistaken for just aging. So if your nails are turning yellow along with weight gain, dry skin, cold hands, or fatigue, it's time to have your thyroid levels checked. What seems like a simple cosmetic issue might be your body whispering, "I'm out of balance." Stat: up to 20 million Americans have a thyroid condition. 60% of them don't even know it. 7. Yellow nail syndrome, a rare but serious condition. If your nails are not only yellow but also thickened, curved, and growing unusually slow, you could be dealing with something more serious: yellow nail syndrome. While rare, this condition is a major red flag and often linked to chronic respiratory issues, lymphatic system dysfunction, and fluid retention, like swollen legs or ankles. What makes this condition even more concerning? It doesn't just affect your nails, it signals systemic issues affecting your lungs and immune system. Doctors still aren't entirely sure what causes it, but it's most often found in people over 50 with underlying lung disease or weakened lymphatic flow. If you notice more than 3 nails showing symptoms like extreme yellowing, thickening, and lack of cuticle, see a doctor immediately. This is not something you can treat with creams or supplements alone. Fact: yellow nail syndrome occurs in fewer than 1 in 1,000 people, but when it appears, it's rarely just about nails. Quick question: have you ever looked at your nails and noticed a yellow tint or something? Just didn't look right. Drop an emoji in the comments if you've ever experienced this, or tag a friend over 50 who should check their nails today. You never know, one comment might actually save someone's health. And if you're finding this helpful, don't forget to hit that like button. It tells YouTube to show this video to more people who need it. So let's quickly recap the 7 possible health reasons behind yellow nails after 50. Fungal infections, often the first visible clue. Diabetes is where sugar leaves a mark on your nails. Lung diseases, when breathing issues show through your hands. Liver dysfunction, toxins that tint your nails. Nutrient deficiencies, especially B12 and zinc. Thyroid disorders, a slowing system reflected in yellowing nails. And yellow nail syndrome, a rare but serious red flag. Your nails are more than just cosmetic, they're health messengers. If you notice yellowing, don't ignore it. Investigate, test, and treat early. If you learned something new today, hit that like button, subscribe for more health-saving content, and turn on the notification bell so you never miss a crucial update. And remember, leave a comment if you've ever had a strange nail change. You might inspire someone else to get checked. Your body is always speaking, sometimes in whispers, sometimes in signs as small as a yellowing nail. After 50, it's more important than ever to listen, because catching these early warnings might just help you prevent something far more serious. Stay informed, stay proactive, and remember, your health is literally at your fingertips.